This video of anatomy of nose contains external and the internal nose, external parts, internal nose, its structures like lateral wall, medial wall, floor and the roof, and also the parts containing in each of the things and how are they formed.
Let's see complete anatomy of nose. The external nose. External nose contains bony, which is 1/3 part, and cartilage, which is 2/3 part. Cartilageous part contains septal cartilage, alar cartilage, and lesser alar cartilage. Lesser alar cartilage is a small bony. You can see it's so small bone, and this is all fibrofatty tissue. The alar cartilage contains still to division the lateral crest and the medial crest. So you can see the lateral part is the lateral crest and the medial part is the medial crest. Muscles of nose: procrius, nasalis alar, depressor septi nasi, and levator labii superioris alveoli neris. These are the muscles of nose. Now going to the internal part of the nose. Internal part contains vestibules of nose, nasal cavity proper. Vestibule which contains hair, mucous gland, mucous membrane, sebaceous glands, etc. and all. Nasal wall, which is the narrowest part of the nose, 30 degree angle. It also provides restriction during inspiration. Resistance during inspiration. The lateral nasal cavity proper contains lateral wall, medial wall, roof, and the floor. Now coming to the nasal cavity proper. The lateral wall will see about the blood supply structure present and nerve supplying it. The lateral wall, which contains inferior turbinate or concha, and it contains inferior turbinate, inferior meatus, middle turbinate, middle meatus, superior turbinate, and superior meatus. It contains superior turbinate and also known as superior ethmoidal recess. Now coming to the structures present into each of the turbinates. In the inferior turbinate, there is nasolacrimal duct, and this is guided by Hasner's valve, present at the terminal part of the inferior turbinate. And in the middle turbinate, you can see there is inferior turbinate, inferior meatus. This is the meatus part, this is the turbinate part. Now coming to the middle turbinate, middle meatus. Middle turbinate contains a frontal sinus, which is at the anterior part, maxillary sinus, which is at the lowest part, uncinate process, and the space between uncinate process and the bulla ethmoidalis is semilunar hiatus. After the bulla ethmoidalis contains, which it is a bulge part. It contains anterior and the middle ethmoidal sinuses. And superior turbinate contains posterior ethmoidal sinus, and sphenoethmoidal contains sphenoid sinus. As you can see, all of the anterior sinus opens into the middle turbinate, and posterior sinus opens into the superior ethmoidal sinus, supreme ethmoidal sinus, or sphenoethmoidal sinus, or supreme turbinate. Now coming to the blood supply and the lateral and the arterial supply of the lateral wall. The nerve supplying the lateral walls are olfactory nerve and the pulse, spinopalatine, intraorbital nerve, and anterethmoidal nerve. This is the anterethmoidal nerve, olfactory pulse, which are contained in rows, and olfactory nerve, spinopalatine nerve, lesser inferior spinopalatine nerve, intraorbital nerve, which is at the anterior-inferior part. Now coming to the arterial supply of the lateral wall. Artery. It is actually of the septum also. Complete septum of the nose. Arterial supply of the lateral wall. Septum of the nose. It is nothing but there are 5 arteries, major arteries: anterior, posterior ethmoidal, spinopalatine branches, superior labial artery, and greater palatine artery, branch of maxillary artery. Here you can see the anterior ethmoidal, posterior ethmoidal, spinopalatine artery, greater palatine artery, which will go from inferior to the superior part, and also superior labial artery. Now coming to the division, like internal carotid artery is divided into anterior posterior ethmoidal artery and supplies to the anterior posterior part of the nasal cavity, and external carotid artery gives branches facial and the maxillary. Further, the facial gives superior labial artery and supplies to the anterior inferior part of the nose. Now coming to the maxillary artery, it gives further 2 branches, spinopalatine and greater palatine artery. Greater palatine artery supplies from inferior to the superior part of the nasal septum, and the spinopalatal artery will give branches from the posterior to the anterior part of the nose. As now coming to the medial wall nerve supply. As you can see, this is the structure of nose. These are the lateral walls, and the structure inside is the medial wall. Lateral wall. Now coming medial wall nerve supply. Olfactory bulb same as the lateral wall, infraorbital and anteriotomidal. These three are same as lateral wall, but the nasopalatine and the cretopalatine are the two new nerves supplying medial wall. Now we'll see the difference between the nerve supply of lateral wall and the medial wall. First we'll do the same nerve supply: olfactory bulb, anteriotomidal and infraorbital. These are the same nerve supplying. And nasopalatine, cretopalatine nerve. These are the newer arteries which will supply from below inferior part to the superior part of the nose. As we have seen the nerve supply of the medial wall, now we'll see the structures forming the medial wall. The medial wall is divided into two parts: the columnar septum, the membranous septum, and as well as the septum proper. Septum proper contains three major bones, which is perpendicular plate of ethmoid, septal cartilage, and vomer. These are the three bones forming the medial wall of the bone. Anteriorly by the nasal bones, posteriorly by the sphenoid bone, and in the middle it is formed by the cribriform plate of ethmoid. As you can see in the picture, as you can remember easily, here the sphenoid is a sphenoid bone, here the cribriform olfactory lobes will come, so cribriform plate of ethmoid, and here the nasal bones. Now in the floor, there will be anteriorly 3/4 and posteriorly 1/4. Both are by the palatine process of maxilla. This is palatine process of the maxilla, and this is a continuation horizontal part of palatine bone. This is 3/4 anterior and 1/4 posterior. These are the structures forming nose.